Potentially, let's share some time.
Okay. All right, I'm going to call to order the Winnebago County Community Mental Health Board, August 2nd, 2023, and it's 2:00 here. Roll call, Dr. Copeland, Dr. Giardini,
Here.
Dr. Gorski,
Here.
Deb Cooner,
Here.
Wendy Larson Bennett, present. Tim Neighbors, Linda Sanquist here, Mohammed Yunus, Mariana Body present, Jason Holcomb, Chelsea Wetz, Nicole Bennett. Welcome and welcome to our audience.
Ed's
Happy
on
that
his
you
way
could
in.
join us. Pardon?
Ed's on his way in.
Okay, so Dr. Copeland will join us momentarily. So the first order of business is our public comment. We did have a request for one. Is the person?
Nancy, are you here? She's not here.
Oh, okay. Moving on to the presentation, Dr. Alex Green and Carol Schuster.
Would you like me to stand up here?
That'd be great. You could, whatever is comfortable for you.
If you don't mind, if I could just give a brief introduction of why we kind of invited Dr. Stegner, Al Green, and his crew here today. We have been convening both colleges and universities and clinical directors for many of our funded organizations and other mental health providers around career pathways for mental health fields. We've had that discussion. We've given you updates as the board. Out of that, we've identified some providers who are focusing in on the peer recovery support specialist pathway. There are some who are more interested in developing nursing and medication prescribing pathways. And then one of the other pathways that we identified as critical that this group identified was the social work pathway. And as part of that, a representative from the College of Medicine who was in that group made the connection to say, hey, well, we've been talking about that as well. And maybe it would be a good opportunity for us to present what those visions are. So thank you for coming today.
Well, terrific. Good afternoon, everybody, and I apologize for being overdressed. In fact, I don't do I apologize, but I'm jealous. So I'd like to share with you thoughts, and I'll present for about 8 or 9 minutes, and I understand we'll have like 5 or 6 minutes for Q&A, but you should feel comfortable in terms of interrupting me as I go forward. Because I'm really going to tell 2 stories about things that we're trying to do, things we're trying or have tried to do with the college, but seem to intersect beautifully with what's going on here in terms of addressing the mental health issues of the citizens of the county of Winnebago. And so I'm going to focus on social workers as part of the story and then psychiatrists. But to understand where I'm coming from, you need to know a little bit about the College of Medicine. So the University of Illinois College of Medicine has been around for a long time, about 150 years. But about 50 years ago, it was realized that it was just in Chicago and that all the graduates were staying in Chicago. And it wasn't addressing the needs of the downstate Illinoisans. And so 3 new campuses were created, one in Rockford, one in Peoria, and one in Urbana. And our campus started 50 years ago. And about 20 years ago, there was a state fiscal crisis. And the president of the university came and met with the dean and said, you know, everything's on the table. They're even thinking about shutting the College of Medicine. But we need to find a specific niche, something that makes you unique that would allow the state legislature and want them to keep you open. But what they decided to focus on was rural medicine. And they decided on rural medicine because Chicago was being taken care of by the College of Medicine there. Winnebago County, to a large extent, with the College of Medicine here. But rural Illinois, which makes up like 20% of the citizens of our state, really are incredibly underserved. And I won't go into any detail here because I think you guys are well aware that the individuals in rural Illinois have poorer health, higher comorbidities, higher depression, higher suicide. And in fact, if you look at their average lifespan compared to people who come from urban areas, there's an 8-year difference. And so we began a process of training individuals who would be recruited from rural Illinois with growing our own. We brought them to Rockford, we trained them in regular medicine, we trained them in rural medicine, and then they went down to residency. And then 60% of them went back and practiced in rural Illinois. So we have about 300 graduates in this program. It's been very successful. Along the way, the College of Medicine expanded, and a College of Pharmacy and a College of Nursing came to our campus. So we became a health science campus. We became broader than just medicine, but staying within the health professions. And then about 4 or 5 years ago, I started thinking, what is our next step for our College of Medicine? And where can we make a difference? And we branched out in a number of areas, but I'm going to focus in on what we thought about expanding the health science campus. And I said, well, why not bring a school of social work, a school of dentistry, public health, and allied health sciences to this campus, have a particular focus in rural, knowing that about 30–40% would stay or not go to rural, and a fair percentage would stay here within the Rockford area, which is happening with many physicians. And we would have the most unique health training program for the rural in the country. And so we came up with this idea, and they tried to sell it. And lo and behold, it caught fire. It took 3 years for the fire to start spreading, but it's now got to the point where everyone in the university, from myself, all of our staff, our faculty, the mayor of Rockford, the county commissioner, and then going to the university, the vice chair of health sciences, the provost, the chancellor, and the president of the board of trustees all bought into this concept. So we're planning on building a new building on our campus. All I need is to get $60 million from the state, which I'm told will probably eventually come, but I have to wait my turn. So in about 3 or 4 years, I'm hoping that we can start that process of bringing all those health sciences to Rockford, which would be individuals who would go rural and individuals would stay here. And along the way, people have been pushing me, saying, well, Alex, why don't you start thinking about bringing one of those campuses sooner? Carol Schuster is one of them. And I kept on saying, no, let's hold off, we're not ready. And then I started hearing about the needs of the community and the needs for social workers. So I called up the dean of the College of Social Work in Chicago and said, well, what do you think about coming out here sooner? Instead of focusing on rural, can we focus on what's needed in this community? And she said, definitely. She said she would love to start working with us. The College of Social Work in Chicago has 500 students. 5 different disciplines, 75 of them in the mental health area. And that's the area that has the most interest. So tremendous interest in potentially going forward on a much shorter basis with Chicago. Simultaneously, I reached out to Urbana because there's a College of Social Work in Urbana as well. And we have a program working with them called the Be Well program, where individuals who are in social work program, going to their MSW, get a certificate in rural and disadvantaged communities. And they put in extra hours, they have specific training, and they get $10,000 per semester for the last last year, excuse me. And then they go on and practice. The downside of that from us, from our perspective, is rural, 93% go disadvantaged, 7% go rural, and that's because they haven't recruited from rural. So that's a different story. But when I spoke with the person in charge, she also talked about another program where they take individuals who have their associate degree or 2 years of college, and then if they want to get a bachelor's in social work, they can do it online with UIUC College of Social Work in 1 year. And she would love to have individuals from Rockford starting to become involved with that. So one of the possibilities in terms of addressing the mental health professional shortage is bringing these social work programs to Rockford earlier than what we initially had thought, and potentially doing this one along with Rock Valley College or with Rockford University. So that's story number one, behind curtain number one. Behind curtain number two has to do with physician training and training of psychiatrists, which are sorely needed in our community. When I came here 10 years ago, I had a vision of working with the CEOs of all of the health systems and creating residency programs in many areas: psychiatry, medicine, pediatrics, surgery. The reasons irrelevant today, it did work out. Although some of the institutions like Mercy have gone forward with their own residency programs. But I think that this city would benefit tremendously by developing a psychiatry residency. So what is a psychiatry residency? First, you know, medical field, to become a physician, you do 4 years of undergrad, 4 years of medical school, and then you go into your residency training when you become a family practitioner, an intern as the surgeon, a psychiatrist. So it's a 4-year training program. What we're thinking about, or what I'd like this group to think about, is really what we've done with Swedes with the family medicine residency. Because we have that residency, when those individuals graduate, a large percentage stay in the community. This helps populate Winnebago County. Won't be easy. I think it's going to be harder to do that than the social work problem, but I really do believe it's something that our community needs. So I really don't have a particular proposal today. I have ideas about ways to go forward in terms of some of the healthcare professional shortage. That's my presentation, and I'm open to questions. Yes.
I have two sets of questions. Well, first of all, I am a dropout of 40 years ago in the MSW program offered at the medical school at U of I. I happen to have a 40-year-old daughter who's the reason I dropped out. I understand. And then I got diverted because you had to finish in Champaign. That was part of the, but I'm wondering how, they used to, I think they flew the professors up 2 days a week from Champaign.
And they did have a social work program.
And can I tell you, it populated the social work community because my would have been peers, you know, Barb Roman, who ran the contact hotline, Cindy Ferry Fisher, works in mental health. There are tons of people that were my cohort 40 years ago.
Sure.
And now they're my age, so they're retired or retiring. But that populated a lot of community organizations and was a great program. And it seems like it would be simple if you could get professors to volunteer to do it.
Recreate it.
Yeah, to recreate it.
But we have a lot of the infrastructure.
Yeah.
I haven't done any of the process of really looking at the nuts and bolts of it, but it's something that surely could be explored, and I don't see why it wouldn't be.
And it was you know, to this day, utilize the materials that I learned in that program 40 years ago. So
I just dropped out of a PhD program.
there you go, there you go. But my other question is, or I guess my comment is, whatever psychiatry residency you are contemplating, one of the areas that I hope you will focus on is the need for child psychiatry. We have such a desperate gap. It's not just Rockford, it's the nation.
It's national.
But we could make a difference, and offering it, developing it, I think could be a real magnet.
I don't think that's where we would start, and I have to look at the regulations.
Okay.
I don't know to have a child psych, you have to have an adult psych first.
Right.
So I have to check into that. But I'm well aware of the shortage, and our chair of psychiatry, Jerry Fox.
Is Jerry and I used to be partners in divorce mediation.
Well, Jerry Fox
Okay.
is been pushing me, she's pushing that rock up the hill to do a residency program since the day she became our chair.
Good, okay.
I don't know if I slept or the chair or how it was. No,
First of all, Alex, kudos to you and to Carol for, and the school for forward thinking in this regard. The psychiatry residency vision is enthralling, really. I'm wondering what you think, other than money, the biggest barriers would be to getting that going. It would seem like there certainly isn't enough patient population to support the providers in their training, but what are the other licensure issues? I mean, what would be the biggest barriers?
yeah, I've had some conversations, it's a good question, though, I've had some conversations, including one today with Dr. Kelly about that. Leaving money aside, I think that there will be two constraints, both I think could be surmountable, one more difficult than the other. One is that Rockford would not have the training in certain areas that are probably needed, like geriatric psychiatry and other subspecialties. But I'm pretty sure we could work that out with UIC in Chicago, which has a very, very strong department of psychiatry. The other thing is we lack the base of psychiatrists here to form that. So we have to have 5 individuals who are core faculty. So we would have to do some heavy recruiting to bring that in. So that obviously addresses money, but you're aware how difficult that could be. I think it's more enticing when it's part of a college of medicine, as part of the psychiatry residency program. So both of them, I think, are doable. But to me, those are the two challenges.
Thank you.
Dan, you have a question?
That was my question.
I just have a comment that our job as a board is to look at proposals. And this is something, you're talking to the choir right now in terms of, looking at gaps and needs of our community, and workforce is, number one. I mean, it's probably the greatest barrier.
I saw the survey.
Yeah,
That's number one in everything.
and it is. So in order for things to get started sooner, the need right now for social worker, to me, that sounds like an easier do than the residency. Not that I'm not saying that's not important, but rather than not to do either one of them, I would hope that you would consider the social work one seriously, because I by the sounds of it, and I also with Wendy, that the greatest impediment for that social work program that existed was the year that you had to go to Champaign. And that really caused a lot of individuals not to get involved in the program, knowing that they would have to leave their employer and all give up, a lot of family time. So, just my comment.
So, yeah, I hear you. So I'm hearing it in a both formative and exploratory fashion.
Right.
Look forward to share with the commission what are the possibilities and what do you think the community potentially might support. And then exploratory, if there's interest, then we would go forward in coming with a proposal of working with Chicago and with their personally, I would like to see both of those programs.
Yeah, I would too.
Really address the mental health issues
We
here.
would love it.
We need both. I guess the other thing, Bill, what it would take is to take a degree of collegiality among the 3 health systems, Rosecrans and Crusader, that we don't feel the same.
Well, I hope we can maybe do something to facilitate some of those conversations. Also, I know one of the barriers, because there's a requirement for some sort of practicum as part of your social work program. And there's a hesitation on the part of organizations to provide supervision because of money.
Right.
I guess I'm speaking as an individual. I would hope you would consider the mental health board as a potential resource to urge organizations to apply for support for it to allow supervision.
Yeah, it's a great point, and that could be part of the proposal, just as they're doing it in Chicago with a certificate for the MSW program. They pay, and here they're paying the tuition. Here you're talking about offsetting the cost of clinicians. Yeah. No, those are real issues. Yes.
Doctor, I have one question. This might be a little bit more abstract. You mentioned that you want to put people in rural areas too?
Correct.
Okay. I'm always
I'm
wondering this.
separated you, but go ahead.
Yeah, I mean, this is probably not a whole lot to do with Winnebago County per se, but this is my question. If we're to put people in rural counties and we have social workers that are basically want to stay in Chicago with the bigger municipalities, if you will, what's going to attract them to go out to those places?
Sure. Well, first of all, let me make it clear, my proposal today is not to train social workers or psychiatrists for rural. I just wanted to give you the background, this is where the college is going overall with this rural health program. And your question is spot on. The biggest problem they have around the country is they have people who train and say, yes, I want to go rural, and then a very small percentage of them do. What we've found, the secret sauce, and other places are now doing it, is we have a recruiter that goes throughout the state goes to all the small communities, the rural communities, and connects with students when they're in high school or early in college, individuals who say and seem to live the life of rural, and what brings them back are their connections to the family. It's not financial, it's not moral, and I think it's a lifestyle, and it's really finding those individuals. And one of the things that we do on our admissions committee for that program is we have 25 people, 20 people interview the students, include CEOs from critical access hospitals, it includes farmers, it includes physicians who practice rural, to really try and ferret out, is this person, are they going to go rural? And interestingly enough, we don't offer any money for the program, they don't sign anything, it really, it's a commitment and a passion.
Okay,
Okay,
Dr. Green, when this board was formed, we had to make a deal, if you will, with the county board, that there would be a referendum at the end of 6 years to comment on whether or not we were making a difference in the community. Because of the workforce issues connected to social work, it's kind of like we need it like now. So the issue is, well, we, at least from my perspective, would be to say to you, please make this a critical priority for your school to do the developmental work for it, because we really do need it.
And I presume you're looking for people at the MSW level, not at the bachelor level?
well,
Well,
Well, I think there are ways of doing both. I would develop a proposal and come back to this committee and I'm sure ask for support in terms of what goes with it.
great, that's great.
But I would also try and work on the one for the psychiatrist and the longer. Now, as you know, simultaneously, the mayor has a position that's, I forget the name of it, that's looking at mental health.
Mental health habits.
The mental health advocacy and whether or not they're going to take up part of this, I don't know yet. But I hear what you're saying. I hear there's an incredible need.
well, thank you very much for the presentation.
So Mary Ann,
Yes, Carol.
I'd just like to clarify next steps. Would be that we would bring the proposal back to this board.
Well, actually, you would submit at proposal time because, I don't know, Jason, you, the mechanics of this, what do you?
Well,
That would be would that be another year? If we waited till grant and proposal opened again?
so in the budget that was approved by the mental health board that is now, has been submitted to the county board for approval, there were 2 tracks this time. One was for $20 million to maintain the core programs of those programmatic elements of the community support system. And the other was a $10 million line item for special projects. We have talked about things that need our priorities, right? In the new strategic plan, we have not specifically developed the mechanism for how to distribute that funding. That's something that me and my team are looking at based on board conversation. Things like accelerator programs that are not just traditional grant programs, but things that can maybe accelerate the kind of like system capacity and do things on that level. So I think we could try to prepare so that when October comes and we know what the budget will look like, that we can communicate very clearly and transparently and with expedience what those opportunities would be. I think that's kind of where we're at, but until that budget is approved, there's really no way of committing funds that's not there. Yeah.
Yeah, the other thing, I failed to mention this, but just as I was thinking about it, I've been very impressed. I haven't dug into the details about the initiative through RPS 205 to train teachers and identify them in high school, have them go, college or university,
Yeah.
and they go to NIU for a master's, and then they have a job teaching. We can also think about something like that.
Absolutely.
In terms of social work.
Yeah.
So there's many different ways that this could be attacked.
Needs a champion.
Was that?
It needs a champion.
Here they are.
Thanks so much for the opportunity.
Okay,
Thank you both.
thank you.
Great stuff.
Okay, moving on to our monthly activity report. Jason, do you want to highlight?
Yeah,
anything?
sure. Because we had that kind of non-traditional meeting schedule, we had the board kind of strategic planning session, and we didn't have a June or a normal July meeting. So we have many months to report on, and I was kind of looking over this thinking, wow, we've done a lot over the last few months. So going all the way back to May, I'll just highlight, I think that everyone was pretty well informed, but we had a really awesome event at the UW Sports Factory where we had some national speakers come in and talk about mental health crisis and the importance of relationships in that. Also, all 30 funded programs, I think all 30 or close to, were able to show up and have a booth. So it became a community resource fair combined with the speaking event. And it turned out great. I mean, if you haven't seen the pictures and you weren't able to attend, connect with Chelsea so you can see those. It was a really wonderful event. And we're very hopeful we can do that again this coming May. Chelsea and I went to DC and presented on the mental health board's work on just that community support system framework in general, but then really in the approach to crisis response. And I'll tell you, the conversations we had from others was really encouraging, because I don't think everybody's thinking through the lens of, you're talking about system of care, but people don't have a conceptual model that they're really connecting to that. And I think that the idea that we were funding that way was really interesting to people internationally. Frankly, we had an organization from Canada that is the equivalent of Mental Health America in Canada. And they were talking about, let's do a peer exchange at some point, because we want to maybe try to figure out how what you're doing in Winnebago County is something we might advocate for on a national level in Canada. So nothing's come out of that yet, but I mean, that's just how interesting that our work was to others. And then, as Dr. Stagnaro Green mentioned, the mayor and county chairman have convened the Behavioral Health Advisory Committee, which I know the board has talked about. I was able to attend the inaugural meeting. They were very interested as well in the research that we had already done, or the data we had already gathered through our strategic planning process. So in the second meeting, which was scheduled very quickly a week after that, we presented to that group on the data we had collected and what we had been proposing, and what we had basically presented to the board back in June as what are the key strategies and moving forward. And so some good feedback. I've offered everyone in that group the opportunity to formalize that feedback as we enter a public comment period for the 3-year strategic plan. So I'm hoping we get not only that kind of, citizen perspective, but we get really the CEOs and administrators of our health systems giving us their feedback and perspective as well before we finalize that plan. And we know that's a discussion item on our agenda today, so I can go more into that.
Jason, am I assuming correctly that you are a standing member of that group?
Yeah, I would say yes.
Yes.
And then just looking forward, as I mentioned, we are in now a public comment period for the draft strategic plan. We have that posted on the website. There was a press release that went out earlier this week. It has been picked up by a few folks. I know the county picked it up and posted it and pushed it through their media outlets. We are going to have 3 open house sessions scheduled where members of the public can come directly and see an abbreviated presentation, not the 4-hour presentation we did for you all, but an abbreviated presentation, and have the opportunity to give that direct feedback before we finalize things and, kind of see what the needs and priorities are for the next 3 years.
Do you want board members at those?
Yeah, I think that would be great to have board member presence. I think we're covered on the Open Meetings Act because we have already published these as open meetings. If we're going to have more than 2 board members, we might just more formally post a notice up front as well to make sure we're covered on that. So if you want to just give me a heads up if you're gonna come, I'll make sure we're covered, but I think we're good. Those are open meetings, so everyone's welcome to attend.
Yes, well, please let us know.
Yeah, right.
48 hours notice.
And that's all.
Thank you very much. Moving on to our action items, we will need a motion to approve the June 2023 meeting minutes.
So moved. Second.
Second, so we have a first and a second. We can do this without roll call. All those in favor, please say aye.
Aye.
Okay. Meetings minutes are approved. Moving on to the resolution 2023 X. Resolution authorizing Winnebago County Mental Health Board funding
Sorry.
and allocation of grant funds for the new funding application for program year 2023-2024. Whereas the Winnebago County Community Mental Health Board published a 3-year strategic plan defining priorities and target population for program years 2022 to 2024 and released a notice of funding opportunity for program year 2024, requesting abstract proposals for new services that fill a remaining service gap, including eating disorder treatment, harm reduction, low-income detox services, infant and early childhood, older adults 50 and up, substance abuse, family and community support, supported housing for youth, families, and adults, youth crisis services ages 5 to 17, and other. Whereas the Winnebago County Mental Health Board received 25 abstracts for new services and up to $20 million in available funding for renewal and new proposals collectively. Whereas the Winnebago County Mental Health Board approved 17 abstracts to complete full application for board evaluation. Whereas the Winnebago County board members reviewed, evaluated, and scored the 15 new funding applications that were submitted according to an established scoring rubric and was published alongside the notice of funding opportunity and developed recommendations for these organizations and programs. Whereas determinations took into consideration the evaluation of each application, including the agency description, proposal description, community support system, proposal budget, intended outcomes, fidelity to targeting and filling gaps, and adherence to any previously stated modification. Now therefore, be it resolved by the Winnebago County Board as follows. The Winnebago County Board shall fund the following proposals totaling $3,570,214.06 contingent upon the execution of funding agreements and work plans. Organization names: Alignment Rockford, How Are the Children? Systems Change Through Community Data, for total amount awarded $215,030. Boys and Girls, that's correct, yeah. Boys and Girls Club, Social Emotional Skill Building and Severe Emotional Disturbance Services, $300,065.73. City of Rockford Health and Human Service Department, Impact, Integrated Mobile Partners Action Crisis Team, for a total of $432,852.79. City of Rockford Family Peace Center, Inclusive Wellness Programming at the Family Peace Center, $200,000. NICNI, Rockford Area Case Management Training and Community of Practice, $77,565. Prairie State Legal Services for Winnebago County residents with mental illness, $30,000. Rosecrans Health Network, Rosecrans Advancement and Clinical Excellence ACE Institute for $95,000. Summit Academy, it's Rosecrans Inc., Winnebago System of Care for $1,194,071. Summit Academy Transition Counselor Mental Health Curriculum, $100,000. The Tommy Coral Memorial Fund and Foundation Family and Community Mental Health First Aid Training, $22,300. University of Illinois College of Medicine, Rockford, CLEAN, Clinical Learning and Education in Addiction, $320,293.26. University of Illinois College of Medicine, Rockford, Merit Medical Evaluation Response Initiative Team, Enhanced Services and Community Prevention Education, $136,597. Winnebago County Assistant State's Attorney Mental Health, $140,125. And Youth Services Network, Inc., Mental Health for Homeless Youth, $306,314.28. So moving on, we will need a motion for approval of these particular agencies' proposals.
I will make such a motion.
Okay,
Second.
yeah, okay, second. Any discussion? Hearing none, I must take roll call for this one. Dr. Copeland?
Aye.
Dr. Giardini?
Aye.
Dr. Gorski?
Aye.
Dick Kunert?
Yes.
Wendy Larson Bennett?
Yes.
Kim Neighbors? Linda Sanquist?
Yes.
Mohammed Yunus? Mariana Abadi, yes. Okay, resolution has passed. Now for resolution 2023, authorizing funded program budget updates for program year 2023 to 2024. Jason, I'm going to turn this over to you.
All right, here's where we get abstract. We took a two-tiered approach to funding this year. And so at the same time, we had received renewal program proposals. We also had abstracts for new program proposals. And the decisions for renewal programs were made first. And then new programs were evaluated. And when we did the new program applications, there was a spot for programs to say, if you were to get additional funding, what would you do with it? Of course, we wanted to make sure those program gaps were filled first. So we're coming back around now with the remaining uncommitted dollars to understand where there's opportunity for one of two things. Number one, we went back to programs that maybe in some cases we didn't give them their full ask. And they said, well, we cannot operate our program at its current capacity with what you've suggested that you give us for funding. So some of those are going to be detailed in here where it is additional funding to maintain current services at the current operational level. And then there are those that were for those that the board rated the highest to say, if we have additional funds left, we'd like to see this program expand. So I'm going to go through one by one and just give a brief synopsis of what that funding is intended to be for. And then I have asked, if you're wondering why we have such a large crowd today, I have asked for a representative for each one of these programs to be present so that if you do have additional questions about why that funding is needed or what that funding would be covering, that they are able to advocate for themselves, okay? So I'm going to start with the Brightpoint Doula program. This was an expansion of services based on board reviews. This would be $60,321 to expand one doula for their current doula program that has now going into its third year. The City of Rockford Mobile Integrated Health Program, in conversations with that team, we understood that there may have been a misunderstanding in our kind of evaluation of their proposal and what was needed for ongoing maintenance of the 911 program. They need $283,044.30 to maintain the 911 software. We paid that upfront lump sum. I think it was $700,000 in the first year for them to get that onboarded. there's an ongoing maintenance fee, a subscription type fee. You think of subscription services, keeps the software up to date, keeps the training of the 911 call operators and everything current and up to date, keeps those evidence-based practices and protocols up to date. The Crusader Community Health Program. You'll see in your attachments some letters that explain where the staffing cost and the contracting of psychiatry costs have increased above earlier year projections, and how because of the way they've shifted their focus on staffing, that it's not as much revenue generation as was originally predicted. They were not able to maintain current level operations at the amount that was awarded. So we basically had to either cut program or give more money. So this was in multiple conversations with Crusader leadership, the amount that was understood to be to maintain, and also to expand the psychiatry component of services to the youth population, which was based on board reviews as one of the identified programs where we'd like to see expansion if available funds were there. NAMI Northern Illinois, this was a $20,000 amount. As I mentioned, the May event that we did, the Building Bridges community event with the resource fair and national speaker, we were able to do that so effectively because we did it in partnership with NAMI, who not only brought their volunteer network, but also were able to procure things in a more streamlined way, because it was not the same standards that we might have for procurement. Not to say it's a lesser standard, but it's the difference between nonprofit versus public procurement process. For us to do that event again, which has been identified with the communications work group as something we'd like to do annually, we think that partnering with NAMI again would be the most efficient way to do that. And while they had dollars left in their budget last year, through a budget amendment we could allocate to that, they did not have budget for that in this year's proposal. So this would be $20,000 to give them the funding they need to host that, to lead that event with us being the core partner for that. NICNI, Rockford Area Case Management Program. One of the ideas that came from some of the board reviews when looking at, okay, we're starting to step into workforce. We're tiptoeing into it. We have the Rosecrans program that's focused on training and workforce. NICNI, to an extent, with their community of practice and case management network, is a workforce support. The Family Peace Center program, where it's really looking at staff supports for all the different agencies that exist within that organization. And when we look at the University College of Medicine residency program, those are workforce programs. And one of the things that I say Dick especially was a strong advocate for, how do we make sure these programs are adhering to evidence-based practices, and who is that external resource that we tap into to make sure that all the training opportunities that are happening, all the workforce development that's happening is adhering to evidence-based practices. And so this money would be proposed to allow for NICNI to contract with a national leader that excels in that type of training model and adherence to evidence-based practices, so they could contract with someone and make that resource available to these programs that are really focusing on that, and make sure all of everything we're trying to do here within the community support system, we're making sure there's that availability and support to make sure we're truly adhering to evidence-based practices. Dick, you can comment on that if you'd like, but that's my best synopsis.
No, it was, as usual, great. What Jason is now talking about, years ago, I worked with Boston University's Psychiatric Rehabilitation Center. It's a national training center. It was originally funded by Bill Anthony, who was one of the more innovative people in modern mental health. He was one of the people that was behind the development of the community support system. He also was the one who began in the movement to to change the culture in many of the mental health environments of that time. He moved it from doing things to people to doing things with people, which was huge. And particularly, in the whole domains of state institutions. And then the next thing that he was very innovative with, and this center represents that, and that is peer support. He was one of the first professionals who did a lot of writing about looking at people who are sufferers of mental illness, but who have great skills that they can use. They can use them interpersonally and can carry on, really helpful kinds of activity. And so that's, so as Jason said, we're looking for a place that can be a background to some of our agencies who tell us that they're doing evidence-based things, but it's hard to find a person in that agency who in fact has the credentials to say that they can provide leadership to an evidence-based program. So this is like what we're doing, of trying to bring support to the system, okay? Of giving them a resource that they can go to that could be helpful to them in development of, like case management, which we have, think about the numbers of positions that we have for case management that we have seen in these grants. So that's the purpose of this.
Remedies renewing, oh, sorry.
Is there a requirement that funded organizations utilize that evaluation process or the support system?
Not at this time, and I can't change the funding contracts for this year. We can strongly encourage, the nice thing about making year-to-year funding decisions is strongly encourage has a lot of authority too, but we can formalize into contracts in the future if there's issues that we identify. Remedies Renewing Lives, their domestic violence therapy and advocacy project, we were matching funds on that grant, and like many of those programs that are focused on the domestic violence population, with mental health resources, of course, because of the VOCA funding that's been cut from the federal funding source and how that trickles down through ICEJA and into the state, just like Rockford sexual assault counseling, which we had already addressed several months ago, Remedies is now experiencing that same thing where they're basically going to get cut. So that money that we've already awarded to them will not be utilized if we don't give them more to cover the loss that they'll see from that ICEJA cut. So they will need $66,526 to maintain that program for this current funding year. And OSF Health System, similarly, while OSF themselves has pitched in their own matching funds for that, which I applaud, we have been a contributor, the Mental Health Board has contributed dollars for that grant program as well. And they are seeing a scenario as well where they're getting cuts from ICEJA, where their renewal funding opportunity, what's being identified in the notice of funding opportunity is a $50,000 cut right off the bat. They can't even request the full amount of what they have been previously been awarded. So they're seeing a $50,000 cut and have asked the Mental Health Board to cover that so they can maintain their program at its current level of operation. So that in total brings us within dollars and cents of the full $20 million that we have to allocate in this program year.
So this action resolution needs a motion for approval. Carrie
Yes. Second.
and
Can I ask a
and
question?
then now we'll go into discussion.
Okay, I'm wondering about the 911 software maintenance. Is that, I imagine that number is gonna go up for maintenance over
Who's here?
time, like everything else?
Hello, thanks for letting me answer that question. I have that information right here with me. So no,
It's not necessarily gonna go up, it will go down a bit. It maintains a steady, kind of right around that $220,000 mark.
Okay.
It dips a little below, goes a little bit above 230, 232, I believe, over the course of, this would be year 2, so it goes through year 6. So there's 5 years of the maintenance cost, if you will, and then that first year was the bulk to do all the training, to get the software installation, to make sure that the CAD system, would be able to integrate with the program.
Okay, so that was part of so there's a sort of a 6-year plan.
Correct.
Okay. At the end of that 6 years,
It drops drastically. It drops drastically, so that, and I don't have those numbers, but that's,
but so will you will still have access to current updates?
yes,
So that the system doesn't become
it does not become antiquated or
a
unsupported.
junkie, at the end of
Still have
6 years? Okay,
Correct.
all right, okay. Well,
Dr.
So,
Gorski.
so Chief, the reality of that cost is that will be embedded in your subsequent year's request, because that's the cost of doing business for the software. Okay.
And what percentage of implementation do you have now?
So currently, we have the first piece, which is called ProQA, that's the protocol-based, which is evidence-based software. And so all of our entire center has been trained on that. Software has been implemented, and now we're working towards compliance. So we have to have 93% compliance with ProQA, meaning that we have to be that good at the protocol, following the protocols. And then after we do that, that gets us to the nurse triage piece, where we have the triage nurse in the 911 center, and then we're really able to start tailoring our responses as people call into the center. Which is what we're really excited, yes, right?
How long do you project that will?
So the average amount of time for the compliance is 9 to 12 months. We've set our goal for 6 to 9. We implemented in March. So currently, we're really shooting for the end of the year to hit that 93% compliance. I mean, the first quality assurance that came back was grim. To be quite honest, it was, you know, we were very, very concerned. I'm told that is completely average for agencies that implement the software, and we've been doing nothing but going up and trending in the right direction since. So our telecommunicators are doing an amazing job navigating this, because it truly is the change in the way we do business. So we're really excited. They're very engaged in the process, and again, they're doing a great job. So.
Well, praise. Thank you. Any other questions, comments? Hearing none. Roll call. Dr. Copeland.
Aye.
Dr. Giardini.
Yes.
Dr. Gorski.
Yes.
Dick Cooner.
Yes.
Wendy Larson Bennett.
Yes.
Tim Neighbors.
Yes.
Linda Sandquist, yes. Mohammed Yunus. Mary Ann Abadi, yes.
That's your money.
Yes. All of us.
Appreciate it for sure.
Okay.
Tough decision.
Moving on to our discussion item, and it is our strategic plan draft for public comment. Jason?
Yeah, so I kind of mentioned it in the monthly activities, but I wanted to just talk a little bit about our process for public comment during this period. It was very helpful for us to initially get that feedback from the board. We did identify a key activities section that you saw, so yeah, it was a lot of strategies. We said, what are the ones that we think are, based on what the board's priorities have been, what we know, what the data is showing us, that we have to say, these are the ones we're absolutely accountable for. If we get to everything, great, but these are the ones that we have to be accountable for. So we have added that section, great feedback. I think we tweaked a few other things here and there. Most of it is the same framework that we presented. Board members are, of course, welcome to give comment as well, whether you want to give me a call or put it in an email or talk about it today. We have public sessions as well, so we're gonna have open houses. We have 3 of those scheduled. They're after hours, after, general standard business hours, so that it can be open to the public and people that might be working during the day. I want to make sure that everyone in the community really has an opportunity. We can go out and do presentations. I can't promise that we can meet every request within the time frame we have, but if there are stakeholder groups or networks that want a presentation to their part of the community, we'll do our best to accommodate that and get out throughout the community. Those requests can be directed to me. And then we are going to close that comment period at the end of August,
31st.
August 31st. We
Yeah,
will
5 p.m.
aggregate that feedback. Let's be very clear, 5 p.m. Central Time. We will aggregate that feedback, make updates where they feel necessary, and then present that information back to the board, and hopefully be able to have a final document in October that can be approved and can guide our next 3 years of work.
Wonderful, great work.
Extraordinary. That was wonderful.
Great job, guys.
Yeah,
Appreciate it.
yeah.
Okay, moving on to our last agenda item is other matters, and I have nothing under other matters unless there's.
I would like to make a motion for adjournment.
That's everyone.
There's a second.
Seconded?
Seconds, yes.
All those in favor, please say aye.
We wait for you.